We're going to get started. I think people are still straggling in, but we're going to go ahead and get started because I know everyone's got to get on the road later this afternoon. So welcome to day 3 of IMC. I hope you guys have all had a great time in this beautiful, beautiful venue we've been at for the last couple of days. You've made some great connections. You all had great dinner and fun last night. And we'll get to it and get through the program. Just a couple of announcements. Stephanie's going to be sharing with you all later this afternoon. You probably have all received an email from our organization about an FEOD community survey. And I really want to encourage all of you to give us your feedback because that survey will drive our programming going forward and help us better understand the challenges that you are all facing and how we can better support you. So I would encourage you all to take, it's a lengthy survey, so I apologize for that, but there's a lot of information we're looking to get back and we want to make sure that we cover all bases. So please take the time to do that. If you have any questions, any issues accessing the survey, you can reach out to any member of the MitoAction team. And when we get all of the results and when the survey closes, we'll be sure to share those results with you, and we probably will also publish those results as well with the greater rare disease community and present that at some conferences. So it's really, really important that we get your participation in that. So if you have any questions about that, please let me know. Again, I would encourage you, please, if you haven't already, please make sure you see IVD Solutions. The CPK meter will be a game changer, as you all know, in this community, and so your input will be instrumental as they're moving forward in developing this technology and tool for you. So please make sure you stop by their table and visit with them and give them your feedback. Lunch, again, will be served in the Shaw lobby on the tiled area. We'll have a break a little bit later this morning. And also, so you guys all know, for the holiday, we always do a token that we send out to our donors and our speakers, just to say thank you for all that they do throughout the year and for helping us do what we do. And so this year, we're going to be sending out a holiday ornament. And so while the kids are in with Susie and the teens are also going to participate, we're asking them to submit artwork. So that we can select one of the pieces that will become then the holiday ornament that we will be sending out to all of our donors and the people that support us the most throughout the year. So I would also say to any of the adults, if you're an artist or not and you just want to participate in the program, Susie has there's some sheet printouts in her room, and you can take it with you and send it back to us. But if you'd like to participate in that, I would encourage you to do that as well. Our donors love to hear from our families and to see the impact that they're helping us make. So please participate if you choose to do so. But the kids will all get a chance to do a piece of artwork that we'll consider for that holiday gift. So there will be an expert series panel at the end of the day today. So please make sure you have your questions ready for all of our amazing docs and speakers. And then I also, again, would encourage you, if you have not done so, please make sure you sign up for the MyMito platform. It's not only does that tool help you manage your day-to-day with FAOD, and there's a version specifically for this FAOD community, but it's really, really critical in allowing us to provide that de-identified data back to the clinicians and researchers to help them gain access to information that's so critical in the work that they do and helping them better understand where your challenges are. So if you have not done that, please see Emily and she can help get you set up on that MyMito platform. So with that, I'm going to turn it over to Stephanie and we will get started today.
I'm going to try to stick a little to the script because sometimes I get so excited that I forget things. But this time is a little bit different. Normally we have a parent and patient panel that we do, and we were talking about a lot of times we do that on the last day and things change, and the reality is that we all hold this amazing amount of wisdom, and I think part of what makes these in-person conferences so valuable is that families and patients are able to come together and share their stories and learn from each other. And so what we wanted to do today is a little bit different, a non-traditional family patient story panel time. And there's a collective wisdom that this group holds in this auditorium of living this journey day to day. And so there's a lot of beauty that comes when we can come together and share that wisdom. And we've done that, right, through roundtables, through one-on-one conversations. And so this is kind of our time to do this together. And for all the teens in the back and for all the young children, you guys have a say in this too, because your voice is super, super important. And so what we're going to do is Sharika and I are going to go around. We're going to have 2 mics, and we're going to ask the community questions, and we're excited to hear your answers. So if you are able to answer the question or you have a thought about it, raise your hand. We're going to come. I do want to give a little bit of structure in the sense that we all have a lot to say. We have allotted an hour for this time. This is a pretty small group, so we'll have a little bit more time, I think, to hear from everybody. But just when you are sharing, try to keep it, like 2 to 3 minutes if you can, so more people can share about a particular topic. But I understand we're all FAOD parents, so we get super passionate about certain topics. So share your passion, and we have amazing clinicians here that also want to hear more about your journey. So this is a time to be able to share about what it is like on a day-to-day living with FAODs. So without further ado, I'm gonna see if we can get these handheld mics going. All right. So the first question this morning is, what advice would you give to a parent who is just learning how to advocate for his or her child amongst medical professionals? That's the first question. And I'm gonna actually start off that question, and then I want anybody to chime in that this question stands out to. I think one of the things that we learned, the biggest piece of advice that we were given when Christopher was small was from another parent who said, your pediatrician will actually be your best advocate. Christopher was our first kid ever, and so to me, I was like, well, if it's not metabolic, I don't need to be calling like anyone. And so I relied so much on his metabolic team, and they were amazing. But that word of advice, I thought, well, that's really interesting. She said, because, there's other things that come up, like as he is aging and getting older. And so if you can have a really great relationship with his pediatrician, then that's super helpful. And so there was a time when Chris was in 3rd grade and he had an illness that led to loss of mobility. And I was trying to talk to his team about it. And I was talking to his pediatrician about it. And she said, I talked to his metabolic team. And she said, they kept trying to tell me this is LCHAD, this is LCHAD. She's like, but I know Chris, and this is not Chris's LCHAD. And that it still gives me chills to think about that. Like, to be able to develop that kind of relationship, she knows Chris, and she knows his LCHAD, and she knows his LCHAD, and that's a beautiful thing. And then she can have a different kind of conversation with his metabolic team than I can, even though I love his metabolic team, and we're close, but she can have a different kind of conversation. And so that's I think a tip that I would give is to really try to engage your pediatric community or your PCPs in regards to your metabolic stuff.
I want to echo that, but I think the key word is relationships. I think the reality is we need these medical professionals in our lives and our kids' lives, and we need them to listen to us. So we need them to know that we trust them, and I think it takes time to build that relationship. But I also think that goes with the ER staff that you encounter and the hospitalists that you encounter, and I think that early on, I realized that I could not look like every other parent in an ER who was freaked out and crying and worried because I needed them to realize that the game had changed when Alex came through the door, and I needed them to take that piece of paper seriously that I came in with, that they may or may not know who that physician is or care, and I kind of didn't care about that, but I needed to figure out a way to get past sounding like all the other freaked out parents in the ER. And I think that it was relationship, it was calm, it was having a plan, it was having backup plans for the weekend that our pediatricians on-call service failed and that we had to go to the metabolic teams. We had them. We had backup plans. And I think knowing that one of the greatest joys in my life was watching Alex ask her pediatrician to be honored at her high school graduation stuff was just remarkable, because she could have hated him. She could have hated all he put her through, and yet they're great friends, and there's great respect with them, and there's great celebration of the things, just like with the specialists that we see. But this is the guy that saw every ear infection. This was the guy that checked every part of her for every virus and every fever the whole time. And their staff, how you interact with them on the phone, how you give them respect for the fact that they haven't blown you off. They're very busy. And so I think relationships with every person you encounter matters.
Yeah, relationship does matter.
Stephanie, thanks so much for the question, and thanks so much to all the parents for sharing your experience. I think one of the biggest pieces of information I remember that's been a game changer for our family was from a parent at the Denver conference. It was the first one we'd rolled up to. I think Andy was maybe 2 years old, like just coming fresh off a heart attack. We're like learning about this community here that we don't want to be a part of. It's like, everything's so overwhelming. And I remember one of the parents standing up saying, I am teaching my child at 3 or 4 years old to advocate for themselves, that we give them space in their, in the doctor's office, visit to ask questions. I just realized in that moment that it's as much as we were freaking out, there was so much we didn't know, that we realized we're already modeling for our daughter how to be a future advocate adult for herself. And it was, I think, one of the biggest pieces for us was making space then for our child to be able to not only just speak up or say a sentence in their appointment or ask a question, but then that turned into being a part of IFSP meetings or IEP meetings, and just knowing every time we're walking in how we behave and how that shows her, how she can behave, and that she's so important, she has a seat at the table, and that doctors, the whole team is important, all of it, and us as parents, and kind of just not losing sight of that we're all in it together. We have pieces of the story that we can't teach the other sides. We're all living in a different perspective of it, and it's all part of how we continue to learn in this community.
Yeah, that's interesting. You talk about advocacy, and I'm curious if there are any people in the upper level that want to add anything to that, what it's been like, how you guys advocate as teens or as preteens with your doctors or when you're in the hospital. Is there anybody that would be willing to share about that? I know it's kind of putting you guys on the spot as we're walking towards you slowly. What does advocacy look like in y'all's world?
I just say at my school being vocal about stuff, especially with my teachers, because when they listen, they want to hear it from the student themselves. And so, especially when I'm at my 504 meetings, my mom lets me give a 2-minute summary or whatever, because it's important that they hear it from me. So I'd say just being vocal about kind of what my condition looks like, and then if, say, on a day-to-day basis I want to, if there's a medical emergency or something, just speaking up and being hey, something's not right, and then we'll have to do this, and that. So yeah.
That's great. Any
Anybody
other
else?
thoughts? Enough ways you guys have had to advocate for yourself? That's good. Thanks for sharing, Chris. You guys can feel free to chime in. You've gotten really quiet since we walked back here. So the next question is how do you explain you or your child's FAOD to a new person? And what do you share and how much? And I pinged my husband actually on this one, because I tend to overshare and be a little bit technical when we go out to eat, and I start breaking down. He can't have fat, and this is what happens in the software. I was like, they don't need to know all of that. So I thought he would be a better person to talk. Okay, he's gonna take a second. Do anybody else have, how do you explain you or your child's FAOD to a new person, or what do you share? Or if you're an adult, how do you share about your condition? Alex. My husband's still trying to wake up.
I'll second some of what even the young adults said yesterday. Analogies is how we summarize. One of my favorite ones that I learned from an early age is to tell people I'm like a car. I got to fuel up to keep going. And so I also think there was an analogy at the conference here with Dr. Broccoli, or maybe it was I saw Dr. Broccoli at some point, and he said something about like a pipe, in the bathroom sink. There's like having an FOD, there's like a crack in the pipe, and a normal person can turn on the sink and it's a full flowing water, spout, and then there's a leak in the pipe, and it doesn't come out as powerful, the water, but also it kind of backs up and creates some toxins in the backlog too. So just analogies, whatever fits best with you or your child's body in terms of how to tell someone really quick, I can't use fat for energy, and I'm like a car. That's kind of my go-to.
I like that. Does anybody else have?
I can't believe I'm sharing these analogies, but I bet other people can, especially the patient group, can understand the sense of when we try down the medical route, people who aren't in our shoes are staring through us at the wall, and it's like we get a little frustrated with that. So I use two analogies, trying to get healthy people approximately on the same page. And it's funny you mentioned a car analogy, because that's one of them. I say, let's go out to your car and remove the 20-gallon fuel tank and put in a half-a-gallon fuel tank, and we'll leave everything else the same. And I'm like, and I'm gonna hand you back the keys. You gonna change how you go through your day? And all of a sudden people go, oh man, yeah. And you start to get some recognition there. And then if they're really listening, I add, and now you can't fill up your fuel tank in 30 seconds. It's gonna take hours to fill up your fuel tank. And then they look at me like, how in the heck do you go through your day? And they begin to get it. And the other thing is to get recognition is I will say, you remember when we were in elementary school in gym class and they made everybody line up to the wall with your back against the wall, and you sit down into like a seated bench position, and they make you hold that position for as long as you can? And everybody starts groaning after 30 seconds because their thighs are burning and everyone's falling over and complaining. I'm like, that's lactic acid buildup. I get that from just talking too long. And they're looking at me like, oh my, you deal with it? But there's recognition. They know what that feels like. And they're like, how on earth do you push through that? Those are my two analogies when I am trying to break through to healthy people to get a little bit of an inkling of what it's like. That's what I use.
I use another analogy. Before I start to use this, I used to explain about the condition, and I felt like some people, they don't really get it because it's rare. Then I start to make an example of diabetes, because most of people understand what is diabetes, and they are not supposed to eat sugar a lot. And so I start to make this analogy. The same thing as diabetic people. They're not supposed to eat too much sugar. We are not supposed to eat too much fat. And the same thing, if they eat too much sugar, they're gonna have hyperglycemia. For us, he will have diarrhea and GI issues. So they will understand it a lot better from how I used to explain it as to explain the whole condition.
One thing I think was really important was also, share only enough with the right people. So when I, for example, apply to a job, they say, there's no discrimination and all of that stuff, but we all know there's some inherent bias. So I try not to share everything if it's not necessary. But then when I get into the position, whether it's work or with a friendship or whatever it is, and I have to go out to eat or I need to take a day off, I explain it. And the person's usually more understanding because they've seen my prior work or they've seen, we've had a long-standing friendship. So if we're at a restaurant, I'll say, oh yeah, I can't eat that much of this food and all of that. But then if we want to go out to a specific place, like if my friends suddenly want to go canoeing one weekend, I have to explain to them, okay, I have a limitation on energy usage and all that, and I try and make it apply to me and not to them, so I don't restrict them. But yeah, it's very much like as needed basis because not everybody understands. There is some judgment, and that can affect a lot of different aspects of life. And I've seen it firsthand when I try to be really open with some friends. And I find out much later that they actually had an issue with it for some reason, even though it didn't affect their life at all. But yeah, so it's really just knowing who to talk to.
Stephanie, if we don't have any more on that one, I have a question. Oh, one more, and then we have a question about the last question.
I actually have a general suggestion. I've had a few comments at this conference about school and having some difficulty getting different teachers and PE teachers and coaches to really understand what's going on and understand and respect accommodations. And that's definitely something that I've encountered with some of my patients. Usually what happens is, it's happened most typically with my patients with concussions, where I'll say, okay, these are the things they can do in PE class, or they can do like after school programs. And sometimes schools still don't really get it. What happens is we have a conference call, usually myself, a PM&R doctor, the school doctor or school nurse, whoever it might be, school administrators, and we talk it out. Something that can really help you out is to ask for an educational advocate. So that is your right as students and as families. The school provides you with that person, and their job is to help the school understand your needs. All you have to do is tell them that you want this person. The person looks at your entire file, any notes from doctors, any restrictions or accommodations, and that, like I said, they should be with you in any meetings that happen, anything going over IEPs to help implement all those recommendations. Is that federal or is that state by state? It should be federal. Mm-hmm.
Okay, question back to the advocacy question a minute ago.
It's kind of not about that, but it's about the relationships that you all have with your pediatrician. Like, what kind of questions were you asking the pediatricians, and what were you looking for exactly? Because I'm not that big a fan of mine.
So I went into the pediatrician's appointment and we had a lot going on because we had just been diagnosed, and then we went in 6 months later, had a second kid diagnosed with it, and one was on a medicine. So I said, I'm overwhelmed and I need your help. Like, I need you to help me track all these specialists and make sure that I'm not forgetting anything. And so I felt like every time we went into an appointment, he went down his list. Like, he felt okay asking me every step of our journey to make sure that we didn't miss anything. So I don't know if that would help or not, but.
Sam's got something to say, okay? Sam, thanks for making me get my exercise. This is nice. All right, Sam, go ahead.
So it's hard to advocate for yourself. Like, you want to tell people that you want to tell that are your close friends, but then at the same time, if they don't get it, you're just like, it's too confusing, and I try not to do any scientific words to help them, but if it's too confusing, I just say, never mind, let us go on.
I think that's good advice, because sometimes, like, Yeah, I think that's good advice. Like, you know your limits too, which is really great. Like, you know, and sometimes you just are like, you know, we're just gonna move on from it. That's good, Sam. With the pediatrician thing, one thing that came to mind is, so we had an amazing pediatrician in Atlanta, and then we just moved up to PA, and so then it's like, okay, we're at square one again. And I think the best advice that I got from somebody along the way was just be upfront with them. So like when I started looking for a new pediatrician, I called and emailed them and was like, this is the situation. We have a medically complex child. This is the condition. Are you like up for it? And I'm like, and I will not be offended if you say no. I just want to know like if you're going to be willing to work with us. And I think sometimes like, it sounds like you already kind of know that situation with this pediatrician, but like if you start to expand and try to look for a different one, just being like, hey, this is our situation, it's totally okay, because some, you know, pediatricians, that's not their passion. I mean, the first one that we had tried to tell us it's not a big deal that he doesn't eat, like when he was like smaller, and Ryan and I were both like, yeah, no, this isn't the one for us, but that was really helpful this go around, because I had a clinician tell me like, no, I'm too busy. I really am too busy, and he's only going to be here for a couple more years. And I'm like, I appreciate your honesty, you know. So that was helpful for us. Does anybody else have any suggestions for how to find, or what questions to ask to see if you're a pediatrician? No, not pediatrician, but you have something else to say.
Okay, so I'm going to spin it off to advocacy at the school. One thing that we do, building relationships, is we try and meet with the teacher. Like, we try and figure out who is a good fit, and then asking them, listen, I know educationally you can do this, you know, but this condition is a medical condition, and so it's an extra thing. Are you comfortable with this? Because we want to inform you. So we start laying the foundation for the relationship, you know, the beginning of summer. And that helps too, because then the teacher is like, oh yeah, and we've never had a teacher say, no, but it just kind of makes them more aware as well. And then getting him comfortable. So that's just kind of an advocacy in the classroom for us and at school.
I'll say quickly for the pediatrician thing, one, realizing that you're not stuck. I mean, I don't know where you live, it's like that's all there is and there's slim pickings, but like making sure that you keep looking until you find the person that you're comfortable with, because they really can be such a huge advocate. One thing I would ask about is their response if you have to call like overnight, like if you have to call like the overnight nurse line or something, what their response is and how they're prepared to support you guys differently than they are other patients. Our current pediatrician, who we got from Stephanie, who's amazing, things like we called because Caleb was having like a vomiting spell, and we were, you know, wondering about that. Our pediatrician wasn't on call, but that next day she saw the notes and called me from her cell phone like a Sunday, like, hey, just checking in, want to make sure he's okay, because I know vomiting is a really big thing for you. You know, so that kind of thing matters when the pediatrician really understands what you're working with and that you need additional support. So just not stopping until you find that right fit.
I'll say about the advocacy part that thanks, Kim, about the school, that really triggered me to think about older kids when they get into high school, when they have multiple teachers. We did the sit down with a teacher in primary and primary school, but once they start going throughout the building and they have several teachers at once, the letter that you send to the school and everything to prep everybody, but it's hard to have that individual meeting with 8 teachers or whatever they're going to have, right? And they only have them for 1 hour. So what I found is you will find your allies in high school and middle school. The teachers that take a special interest or for whatever reason connect with your child, they will let themselves be known, and you'll develop those relationships and hold on to those and talk to those teachers. You know, of course, go to parent-teacher conferences and all of those things, but when things have come up before with my kids and I need to send an email to the teachers to let them know what's going on, I don't always email all of the teachers because all of the teachers don't care. I will pick the allies that have really made themselves known and give them a little extra more information and say, this is going on. Can you please watch out for my kid in this situation because, you know, we're dealing with this right now. And that's been really helpful for us.
Regarding the pediatrician, when I was maybe lucky with the pediatrician that I have for my son. If I wanted to describe, he is very understanding and he cares. Because I was in a lot of situations that when he wasn't there in the office and someone else, another pediatrician is gonna step in, they will not do the same and they will not listen. I want the pediatrician to listen to me because I understand the situation or the condition maybe more than him because it is a rare disease. There is one incident that the genetic doctor wants my son to be in the hospital. She wants to admit him, but she wants the pediatrician to go ahead and do the admission. And his pediatrician was not there. He traveled at that time. So another pediatrician saw him and he didn't want to admit him. And he looked at my son, he's fine. And he doesn't know about the situation. And I was like, okay, so what are we gonna do? We need maybe to educate the other pediatrician in this office about the condition. So when his pediatrician came back, I told him about this situation. So he wrote a letter and put it in my son's folder. So everybody, whoever is going to see him when he's not there, they will have an idea what to do. But I really look at the understanding part, and he cares to listen and you know, also listen to the other doctor, because this pediatrician wasn't listening to the geneticist. It was very hard at that time, and it passed, thank God, everything went good, but yes, he needs to care and understand and listen.
Are you walking towards somebody, Shrika?
I was just stationing myself
I was stationing.
on the side.
So for those of you who are, so for those of you who are older patients who have jobs, how do you navigate? Ali started to bring that up a little bit in what he was sharing. I'm curious if you'd be willing to share a little bit about how you approach that as a teenager, as an adult. And I hope my son is listening to this right now because he's transitioning into working at some point. But does anybody have any thoughts on how to do that well, or how to pace yourself, or what your experience has been like with that?
So I will say definitely everybody knows their own limits. I'm sure we all know that by now, but when I was in college, I always tried to, before the semester started, I would just go to the accommodations office. I'd get everything prepared in advance. I do all of that, and I realized right when I started working that it's not the same. So I mentioned how I don't necessarily, in my interview just say, hey, I have this condition, it limits me. But as soon as I started, I spoke with the person directly over me, like privately, and I explained to them, hey, I'm fine now, I can do great work, but at some point, if I get sick, I need to take some time off, and I could work from home, I can do whatever I can, but if I'm really not feeling well, those are gonna be my sick days, and whether I'm getting paid or not getting paid, I need to take that off for my health. I've been fortunate that I work in the medical industry, so they fairly understand that it's important, but I feel like if you're in a different industry and the people don't understand, then you shouldn't work for them. If they're not willing to accommodate to you, then that's not the job for you. You have to set that standard and that boundary, and also pre-plan. So like we're all traveling right now. I planned before I left to take a little break, and after I come back to take a little break, and it's not that easy because that's a lot of time off, and employers don't always like that. So, you gotta just work with them and have them understand. And at the end of the day, if they don't understand, I decided I don't care because it's my health. I used to care a lot in school, and then I realized, you know what? I've had too many needles. I'm over it. I'd rather just deal with it or find another job or just figure it out. I know not everybody's able to do that, but definitely try and prepare for it in advance and go in with that mindset that health comes first. And definitely find a career where your lifestyle is, there's a work-life balance, because you will burn yourself out if you don't.
Thanks, Ali. Who else?
So I've only worked one job so far in my life. I'm still like on the younger side of adulthood, but I'm lucky enough to have an employer who I've known for a long time and whose son is also diabetic, so she gets it. And I had no difficulty with, like applying for the job. She's my cousin. It's not nepotism, but but I would say one really important thing is making sure your coworkers know the situation. I work at a child care, which is a pretty demanding job, both physically and emotionally. And I do definitely have to take my time, even though the kids need more than I do in a lot of situations, to like go get a snack or to sit down. Some days we go on long walks and I have to really take care of myself. And usually I don't think I've had a crisis at work yet, but hopefully never, not yet. But I would say like making sure your coworkers know what's up. And I would go back to what Ali was saying with not telling too much or not sharing too much, because you don't want to like give them more than they need. But yeah, I'd like have a coworker that I say like, I need some fruit snacks. She's like, don't faint. So she doesn't really know what the symptoms are, but she knows that I need something. And that's the important part, is that I have people who can cover me if I need to go get a snack or take a sit down or whatever. So that was a big part.
I'm speaking as a caregiver. If you work for a larger corporation, often companies will have employee resource groups, and you can engage with them. So they usually have groups for, women or different ethnic groups, and then my company has one for people and caregivers of living with disability called Capable. So that's a really good way if you're working in a larger corporation to get connected with other people that might not have exactly what you have. But I just joined mine a little over a year ago, because my mindset is not that my kids are disabled, because I'm in complete denial. But but I joined a little over a year ago, and that's been so gratifying to just connect with other people at work who get it and get living with or caring for people with disability. And we just celebrated, this is Disability Pride Month in July, and so we've been celebrating the Americans with Disabilities Act and really raising awareness about the accommodations that we all have rights to. So I would just encourage you, if you're working for a company like that, to engage with those organizations available to you.
I'll piggyback on that as far as the larger organizations, and I actually don't even know if it's a size thing. Maybe somebody that's in the legal field here will know. But FMLA is actually something that you could take advantage of as well. I used to think that FMLA was just for, maternity leave or large gaps of time, but actually I engaged it when Kanan was younger. It really affords you the opportunity to pivot your schedule. So if you need like a more flexible schedule, start later, leave earlier, work longer days and have some days off, or just flexibility with your work demands, it covers that too. So it's not just when you need to take large spans of time off. It affords you the opportunity to have more of a flexible work situation, and your manager, your leadership at your job, they have to abide by it because it's legally binding. And so that's just a pivot too for people that might need. I don't know that our kids working in like Bath and Body Works may have that, but as you get older and you're more in your career, you probably have access to that. Okay.
FMLA has to be offered if your company has more than 50 employees, and you have to work a full year. So after a full year, you're eligible for FMLA if your company has over 50 employees, and you can take up to 12 weeks. It's full-time. You don't have to take 12 weeks straight, but you can take 12 weeks of full-time off. So you can scatter it, you can take it part-time, you can take a day off. We have at my company, we have some folks that are on FMLA, and they just use their 12 weeks throughout the year. And each calendar year, you get 12 more weeks, and if they need to take a day off. And basically, it's time off without pay, but it secures your benefits, and it secures your status as a full-time employee.
Did you say 50 or 150 people?
50, yeah, your employer has, the company has to have 50 FTEs, full-time equivalents. I don't 100% know if it's a part-time, full-time. That might be an agency thing. I don't know that. I know at my company, it's full-time people.
Thank you. I don't know, but I am a state employee, and I work for the health department. And I would like to share with you the benefits that we get. It might be very reasonable to us. The insurance is great. You know, you don't pay too much. Also, the benefits like the FMLA, there are so many acts that we can have. We can also, sometimes they accommodate to work from home, even for the parents. We can work from home just to be able to take care of our children. If the child is working for the state when they get older, they have a lot of acts that they can work with you so you can stay. Of course, you have to work for 1 whole year first, and then you will be eligible to all of those benefits. I was trying to get Ali to work for the state. He actually had he had a little it's a kind of internship slash volunteer with the administrator in one of the clinics there. He liked it, and he felt it's very reasonable and accommodating. Even when he was volunteering, it's not demanding for a lot of physical work. It's mostly just, mental work. And it is easy compared to what he is doing now with his companies.
I was gonna ask you, Chad, if you were gonna chime in or not,
So many thoughts running through my head. I promise not to share them all. I would like to concur on what everybody said. All great stuff. I wish I knew all of these things back in '97 when I got out of college and started working. And I will freely admit, knowing where my health was and I could feel how it was declining, it scared the bejesus out of me. So diving into that, of course, what do? I decide to work for a highly competitive Wall Street firm in finance, trying to build clients, because that's a totally successful, easy thing to do. It's like a 95% fill rate anyway. But I had always been fascinated with it and just kept kicking myself in the butt to keep going and keep going. And somehow I survived that environment for 12 years. And then with my book of clients and knowing that my health, I needed more flexibility than that structure would give. And you could probably imagine what the mentality is in a financial firm that's like go, go, go all the time. They don't really want to listen to what they would view as excuses or whatever. So it's like, what I would say is pick your industry carefully, pick your company carefully. These new programs that are available that allows people to be human are awesome. Like, I wish I'd go back in time and apply these things and be like, that'd be great. But what I did to kind of save myself was I switched to being a business owner. I actually opened up my own company and I could work from home, advise and bring my clients with me. There's structure in the industry to do that. So I share that from the standpoint of don't be restrictive in your thinking, be creative. Like, looking back, I'm like, man, I wish I knew what I knew today in terms of all the different career options and the job options and all the creativity out there. I think I was way too structured in my thinking when I was in college and being like, oh, what should I do? What should I do? And what's my skill set? What do I want to be spending my days doing? I remember, I didn't open my mouth about it, but man, there was a whole lot of panic and, oh my goodness, I don't want to end up on my parents' couch sort of thought process. It was like, oh my gosh, I gotta do all I can. And I will just say 30 seconds on this one last thing, because my background, working with clients in financial planning, asset management, liability management was 20 years. I was thinking through that for other people. Now I'm gonna marry that idea with this group that is my family. One of the greatest things in the world that I did for myself is when you work for a large corporation, you get that, I'm showing my age, the employee manual, the binder. We don't do binders now. I know we got websites. But so there you look for an opportunity for long-term disability coverage in those websites. If you can work for a larger corporation that's going to offer you that, we know the trajectory of our health, and if we're declining over time, that stuff is worth its weight in gold. And if anybody would like to hear more details on that, I would happily share my journey in that area, but it's critically important. Thanks for listening.
Thanks for mentioning that, because I think the discussion of long-term disability is really important, and you have lots of tips and tricks to the trade, so I encourage you to chat with Chet if you have more questions about that. Any other thoughts or, yeah? Oh, Shrika's there.
Just to answer the part-time FMLA question, because I just looked it up, if you average 24 hours a week for a year, you can qualify for part-time FMLA.
Thanks so much, Carrie. So switching gears a little bit, there was a question that we had about siblings. And so we're curious, do you have any advice on caring for the unaffected siblings in the house? And siblings, or anybody in the back row, if you have thoughts or opinions about this as well, but do parents have tips or tricks for that, or thoughts about that?
This is something I worried about a lot. I'm very thankful that Alex's older sister, came out about as normal as she was going to, but we were very fortunate. Our families were nearby, and I think having or defining your support around you is very important. I know that often I get on the phone with a new mom who's in the hospital, and I'm thinking, I don't know who you are, I don't know what's near you. So I start to ask them about, do they have family nearby, or do they have a support network, and to build that a bit. And I hopefully can share that it's surprisingly, I do think there's a lot more research out now about how to help affected siblings than there was when Alex was young. I think I might have loved that if I could have gotten a hold of that. And I also think that the Child Life organization may have some really great tools that we can take advantage of, as Alex was investigating that as a future career option. I think that there really are some things like that in that space that I don't really know because they weren't available to us. But I do believe they can. I really think we need to be reaching out to the Child Life groups within our hospitals, or maybe associated with our clinics. And also some of those clinics have outpatient Child Life. So you might ask about those resources to see if you can get some insight that might be helpful. I feel like there are just more tools now. I don't know how to use them, and I don't know how they fit your schedule, but I feel like there are more tools, and there's more actual research to give us some insight as to, I think, I will say for us, routines were important. When the grandparent brought Big Sister to visit, we were all so happy. Alex got to hang out with Grandma, and I got to take Big Sister, and then it was years later that I found out that those are some of my older daughter's favorite memories of she and I taking these walks through the children's hospital of all the fun things, and also she was a foodie. She always liked that I bought her a smoothie. So, but again, learning routines and creating things that are expectations. I think our family found that hospital night routines were important as well. How we spent our evenings in the hospital and how we said goodbye at night was very important. And again, so keeping routines, finding your network and your support group, and I do believe that there are a lot more resources available in this space than were when I was younger, but I wish
wish I knew them to tell you, but I think they're out there.
Any other thoughts on how to support siblings?
I might speak on behalf of my sister. As adults, now adults, and talk to each other about things from our childhood. And there are, for Child Life, there are sibling days at hospitals and things that you can have special events for the sibling to feel special in some way, that they have a sibling with a rare disease. And something my sister mentioned to me later is, she did feel like there was a lot of focus into Alex's needs and, what I needed. I needed to go to the hospital, the doctor, and all the stuff that I was going through. And so just some encouragement and advice would be just find the little ways to show you're unaffected, that sibling, that you still care about what's happening with them. Even if it's a minor thing medically that they're going through, like finding a way to show them that you still care about them medically, even though you are, torn between multiple kids and the FOD stress. Just Claire mentioned to me that finding those little things to make sure that, she's still important too, when she has things going on.
I want to add one thing for what you said. Also involve them. Involve them. That's very important. They will understand a lot more than when you just tell them about the situation. And that happened with my daughter. My daughter is older than Ali. They've been always, seeing me, what I do when he goes to the hospital, and before also at home. They know and they understand his situation. However, when they are involved, it's completely different. Ali went to Pittsburgh. I wasn't able to go with him, and he got sick over there. His sister was with him. She took care of him to take him to the hospital, to stay with him over there, to do everything what I was doing. I didn't know that she knew that whatever I was doing, that she knew about it, so she did for her brother. I was so proud of her, and I told her, you have to let them know. Also, you need to talk to them and let them know that you really appreciate and for their understanding and what they are doing. But involvement is very important.
I just want to piggyback off of that as well. We tend to operate as a family unit, and so when we'd go in the hospital, we all went into the hospital. Even when my daughter was in school, my husband would grab her, and then they would still stay till like midnight sometimes, and the nurses were very kind, and we stayed late. And at that time, I think she was 7, and she still remembers, she's like, she got to eat Chick-fil-A every day. And so we all have different journeys, right? As a patient, as a caregiver, as a sibling, and they are not identical even though we're going through the same thing. And so when we'd go see Dr. Vockley in Pittsburgh, we all travel as a family, we'd all, that's just what we did. And so to try and create that routine, that family paradigm.
Is there any question that maybe somebody wants to ask somebody else in the audience, or you want to kind of pull the crowd for? Absolutely.
Just as a parent and a teacher, I think that it's really important that we have honest conversations with the teachers. I had an MCAD student several years ago whose mom came in and used very broad terms, didn't want to tell me the name of the diagnosis, and the more she talked, I'm like, this sounds like my life. What's it called, ma'am? And then she said MCAD, and I was like, oh, we're together. And, and sharing that, but also just making sure that you explain to the teachers what to look for. I know it's hard in high school and middle school, but I've been very fortunate, like I work at the school so I can handpick her teachers, but at the same time, it's like you make those connections with the teachers and then they connect with your child so that they know what to watch for, because she had a pretty big crisis at the school and the teacher ignored her. And thankfully I was on campus and I was able to go and look at her and knock on the door and I'm like, we're going. But 3 other teachers had seen her in the hallway that day and had texted me and said, you need to come look at her. So I think like making sure that they know what signs to look for, like what personality changes in your student. We have that listed under 504, like if she ever stops talking, you need to call somebody immediately. And y'all have witnessed that. But I think that it's one of those things that like teachers are human too. Like I might have a personal connection to everybody in this room. Other teachers might not, but at the end of the day, like I don't think anybody goes into teaching that doesn't want to be there and be the best person for those students. So I just think like making sure that like if you're present and you're actively involved in your child's education and their 504s and their individual health plans, you will get the response and the care that your child needs while they're there. So.
Love that. Thank you so much. Other thoughts? Of course, Backley has a thought.
So I'm a physician, but I'm also a sibling, and I have a genetic bone disease that runs in my family. It's dominant, so it's 3 generations before me and 2 after me and my older brother had it, and it involved him being in the hospital a lot of surgeries. It predisposes to cancer, so a lot of cancer, including my father when I was probably in junior high, and then eventually led him to have to retire when I was in high school. And I mean, even things like he couldn't do the yard work anymore because his disease was so bad, and my older brother had it, so it fell to me. And if you ask my wife, she'll tell you it's perfectly reasonable when I say that I was completely oblivious. This was just my life. And my brother was always my best friend. We were 15 months apart, and we were like twins. You know, it's like it didn't matter what one of us was doing; the other one was there. And so I am not telling you to ignore this issue, but I am saying that maybe your unaffected kids and siblings are more resilient than you might think, and they've known about this all their lives. It's just their life. It's their brother. It's their sister, and that means more than any disease. It means more than any apparent special treatment, because I can tell you that after a very short period of time, it became perfectly clear this was not special treatment. This was not something anybody should have to go through, and so we enjoyed each other when we were able, and he supported me in as many ways as I supported him. So give your kids, give your siblings the credit that they deserve.
So we're a case study of 2. Maybe we could publish that. So I'm a sibling too, not of a genetic condition, but my sister had cancer and multiple health issues growing up, and so I really appreciate you sharing that, because it does I mean, but she was my sister, right? Like, and that's like how we always viewed things was, she's my sister, no matter what she was in the hospital for next, or what was going on, or what treatment was next. But it impacts you. I mean, I don't know. I don't want to put words in your mouth. Maybe that's not why you became a geneticist or was interested in the field. But for me, I didn't realize what a positive impact that had, and the work that I'm able to do now. And many of you here know me in the FEOD space, but I lead support calls also for patients with mitochondrial disease and patients that are grieving and dealing with death and dying. And the only reason I can do that is because of my sister, and because of watching my sister deal with her grief and deal with her pain and her lifelong pain, and then losing my sister in my early 20s. And so the impact that these things have, I think, as parents, my mom's told me, she was like, I was worried you were going to be screwed up forever. I mean, there might be some truth to that too, but and I'm okay with that. I've accepted that. But I do think that the impact that it's had, it's enabled me to be who I am, and it's changed me for good. And I think that's the same, when I look, and Chris is in the room, so I don't have to worry about embarrassing him in this moment. But I think it's the same for Chris. Chris is who he is because, he isn't just El-Chad, but he is who he is because of his experiences with El-Chad. And he's able to sit with people and, be empathetic in such different kinds of ways when I look at his peers. And so I appreciate that, and I'm glad he is who he is. No, obviously, we all wish we'd have less hospital stays, or that my sister was still here, but yeah, growing up, she was just my sister. That's just a really important point that you made, and I really appreciate you sharing that.
So I wanted to say, from a clinician standpoint, have your clinic get the sibling involved. So the most fun I had in clinic was when the entire family unit, which it was siblings, grandparents, aunts, and whoever, and I would ask the sibling to help with the food recall, not the parents. Hey, what did your brother eat for breakfast this morning? Oh, this is what they had. And it gave them the ability to feel like they were important. It was, hey, we're gonna try a new formula. Do you wanna try it with them? Yes, I do, so that they knew what it tasted like. Or when they went, here's the recipe, can you help mom with the formula at home? So you get the siblings involved, and it makes them feel like they're helping create a world for their sibling that does have a disorder. So I would say, if you go into clinic, just kind of have a side conversation with your clinic. If you feel comfortable, and if your clinician feels comfortable, hey, ask their sibling to get involved in the conversation. And again, that was some of the most fun we would have, because the siblings would oh no, you told mom you ate 6 Teddy Grahams, I know you ate 8. So it was just a lot of really fun conversations. So I would just say, get them involved in that medical piece of it. I mean, that's for them, their way to even help advocate for their sibling.
Any last thoughts? Oh.
I would agree if they go into physical therapy also, because exercises can be very boring on their own. And I've noticed just a slight tinge of maybe something you'd call competitiveness in these guys. So making things a little bit of a contest can make it more fun and engaging, both in therapy and when they're doing their home exercises.
I just want to add a minor funny story, because this all kind of reminded me of that. So when my brother was 3 years old, he's 8 years younger than me. When he was 3 years old, he saw me drinking my medicine all the time, and he thought that it was because I liked it. He didn't understand the concept of medication. So he decided, while no one was looking, to go into the fridge and then drink the entire bottle for the day. And he quickly realized how bad it tasted, and he ended up in the bathroom for 3 hours. So from then on, he realized, oh wait, this isn't something he's just doing for fun. So he kind of understood more. So yeah, definitely them being involved is important. Probably not to that extreme, but this kind of reminded me of that.
And I think that's a great story to end on. So everybody give themselves a round of applause. This was a great time. So Sarika is going to actually come and introduce our next speaker.
thank you, everyone, for taking the time to share from your hearts. This is really such a key, fulfilling moment of our time together, so thank you guys for sharing. Our next topic is hospital woes, understanding medical trauma. And it's very important, obviously, to all of us here. So we're so very lucky to have Dr. Daisy Sang here with us today to help break down this topic and give us useful tips for when we experience hospitalizations and appointments that can lead to medical trauma. Dr. Daisy Sang is a clinical assistant professor in pediatric psychology at the University of Michigan Health and C.S. Mott Children's Hospital. She has almost a decade of experience working with children and families impacted by a wide range of mental health challenges and adverse events. Currently, she provides psychological assessment and treatment to children in primary care and outpatient specialty clinics. Previously, she spent 2 years providing inpatient psychological consults to children who were hospitalized for various medical conditions, including those admitted to the PICU and NICU. She has given seminars to medical professionals and learners on trauma-informed care, which continues to be the focus of her clinical and research passion. When she takes off her psychologist hat, Dr. Sang enjoys baking, traveling, and taking funny videos of her almost 2-year-old son. Please give a warm welcome to Dr. Daisy Sang.